To find out more about how medical schools partner with hospital systems to train the doctors of the future, we're going to travel to Wayne State University in Detroit and meet Dr. Valerie Parisi, Dean of one of the most outstanding medical schools in the nation, the Wayne State University School of Medicine. Dr. Parisi, we're so happy to be here on the campus of Wayne State University School of Medicine. Thanks for having us.
Oh, thank you so much for coming, Mary.
In today's Champions of Care show, we want to understand medical education and the role medical education and physician residents play in the overall health care for a community. Tell us about getting into medical school. How do you do it? What are all the stages?
Getting into medical school is not so easy today, and it comes and goes in this country as to how many people are applying to medical school, but it's really hard today. Medical students can come from undergraduate school, so when they're finished college, or they may be in graduate school getting a PhD or a master's degree or something and then decide they want to go to medical school, or they may come from the workforce, decide they want to go to medical school and that was an unrealized ambition and they got out there working as a teacher or a scientist or something and they want to come back to school, and so they apply.
And how many do you accept every year, and what are you looking for when you're deciding, yes, this student is Wayne State University School of Medicine caliber student, and I'm sorry, this one is not? What are you looking for?
Well, we have a very interesting process and something I'm very proud of to be here. We have what's called a holistic admissions process. So first and foremost, baseline, you have to be smart. It's very hard to come to medical school, so we have to know that you have the scholastic ability to finish medical school. But there are many other things that are important. So not only your grade point average and where you went to college or graduate school, and the medical school admissions test called the MCAT, Medical College Admissions Test score, those are only 2 of 7 criteria that we look at, and we weight equally. A lot of people don't understand that. They think, oh, if you have a great GPA and a great MCAT, you'll get in, nobody cares about anything else. We here care very much about other things. We care about people's ability to be compassionate, people's ability to communicate. If you're a terrible introvert and you don't like to talk to people, maybe you should be a scientist and not a doctor, because so much of medicine is being able to communicate, and we at least understand this now. And the other things that we really look at are something that we call distance traveled. What's happened in that individual's life from the time that they were young?
Dr. Parisi, Michigan educates a lot of future physicians. What is special about the Wayne State University School of Medicine?
I think we have a very unique school, Mary. First of all, it's the largest medical school in the country that sits all on one campus. So we have 1,288 medical students here. It's huge. So it presents a number of unique challenges to try to educate all of those students as well as we do. The most unique thing, I think, about Wayne State is the caliber of our students. Our students are so community-minded that they run more than 70 organizations that help other people.
How do they find the time? Isn't medical school all-consuming?
And that's exactly the question that I asked. When I went to medical school, I didn't have time to do anything except study. So our medical students manage to find the time to do this. They run mission organizations in many, many countries, in South America, in the Caribbean, in Eastern Europe, in Asia, in Africa. I always have a group of students. We just sent off Dr. Diane Levine and her husband with a group of students to Ecuador on a mission last week. Dr. Stanton is taking a group of students to the Bahamas on a mission next week. So we have students who run an organization that takes children with cancer to summer camps. And these are all things that they do themselves, not required, not something they have to do. These are organizations that have grown up around our students. And just this year, 2 of our technology-oriented students just started an organization called Open Source Medicine, where they're taking a lot of the medical school content and opening it up, digitizing it, and putting it on the web to share with medical students in other schools. Now, would I do that? Geez, no. I would think that'd be proprietary, but they believe that all knowledge should be open-based. So These are this is what our students are like.
That's
We really
incredible.
are unique.
So the goal is to get physicians ready to practice excellent medicine. What is the role hospitals and hospital systems like Oakwood play in that overall training process?
Well, it's critical to have really excellent hospital partners. And in the old days, medical education was 2 and 2. You spent 2 years in the classroom learning basic science, and then you immediately forgot all that and spent 2 years in the hospital seeing patients. Now the patient care experiences come right back to the first year of medical school. So it's critical that our students are at excellent hospitals with excellent practicing physicians and nurses and other healthcare professionals from whom they learn. And then what we hope, and the governor hopes, because we're having a shortage of physicians, particularly here in Michigan, is that our students who become residents and stay here for the residency will then choose to practice here as well. Last year, we had 60% of our graduating class stay and do their residency in a Michigan hospital. And I'm hoping to inch that up a little bit higher. We've been inching it up over the last 3 years that I've been dean.
Now, a lot of the private practice physicians at Oakwood and elsewhere are also faculty. What's in it for them to teach the next generation of physicians?
Boy, what's in it for them is a big challenge because medical students ask a lot of questions. Some because they don't know, and some because they really want to push the limits of knowledge so that they can understand everything about how to help a patient and their family. What's in it for them is that they are pushed to stay current, whether they want to or not, because they have many, many questions asked of them all the time, all day long. And so I think it's a wonderful give and take, a mentee-mentor relationship.
Dr. Parisi, you're in the business of teaching, and you have taught me and our viewers so much about medical education and its connection to outstanding health care in this community. Thank you so much for being on Champions of Care.
Thank you so much, Mary. We so much appreciate our wonderful partners at Oakwood Health System and all the wonderful Oakwood physicians. Thank you.
It's a pleasure.